Yeah, good afternoon, dear viewers. My name is Dr. Ronald Ocaatre. I work as a Assistant Commissioner in Ministry of Health, in charge of health promotion and strategic health communication. Today we are in the Nebi district uh, in partnership with the ADRA. The purpose of our partnership is to work together to see how best we can control and prevent Ebola virus disease that is ravaging our country and our neighboring country. Today, we had an opportunity to meet the district task force members of Navy District, where we had fruitful engagements. We took them through facts about Ebola, and then we agreed on their roles and responsibilities. And we also agreed on how best we can tap the existing available opportunities, and importantly, how we can partner with our colleagues across the border, that is DRC, specifically the leadership of DRC, who should be able to help us overcome this outbreak. So far, we as a country, we have about 19 reported cases, of which 14 actually came from DRC. Unfortunately, 2 of them passed on. But so far, for now, about 3-4 days, we have not received any new cases reported. However, we still have people who are on quarantine, and we have those who are on admission. We have also discharged some. So we think so far all is going well. But our biggest challenge, especially for the very high risk districts that are bordering DRC Congo, is the porous borders where uh, people come across the border without following the main entry points. This this gives us a big challenge so that we cannot screen everybody who comes. However, from our discussions with the district leadership, they have given us very, very key suggestions of how best we can overcome this. One of the key issues they would wish to undertake is the issue of cross-border meeting. A cross-border meeting is going to be with the leadership in DRC, and we are trying to work together with our partner ADRA in order to see how this can be actualized. They also mentioned about having interpersonal communication. That means organizing meetings in some of the sub-counties to go and speak to the communities and the local leadership there in an attempt to see how we can control this and prevent this outbreak. So we think this guidance is very important. We'll do everything within our powers to see how we can build on what the district thing works and also how best it can be implemented. So the meeting was a very fruitful one. It was chaired by the RDC. In attendance was the LC5 chairperson, the DISO, the deputy RDC, the chief administrative officers with all the heads of departments, and also the team from Ministry of Health and ADRA. So we have already made our resolutions, and we think ADRA should help us look through the response plan for the district and see the areas where they can actually give us support. Because the most important thing is for us to look at what the district has prioritized and see if we can deploy resources to be able to support the district. Because ultimately, supporting the district means we are trying to curb the infection from spreading in our communities. We still have challenges of border markets, which are now shifting deep into Congo. But we think this should be addressed when we meet the leadership on the other side. So we call upon every other person to cooperate with the local leadership of the district, because a problem in a neighborhood is a problem for us all. And the biggest challenge the leadership has presented to us has been issues of resources, resources in terms of fuel, maybe some little allowance to facilitate the teams that need to be moving. So if we can put our hands together and give whatever little resources we have to enable the district leadership to move to these areas, to have the cross-border meetings. We think it's going to go a long way in helping us to maintain the status quo. We don't want to see a local community spread. We don't want to see new cases. We don't want to see this Ebola virus escalating. And that can only be possible if we put our acts together, we work together. I want to thank ADRA for the partnership it has with government of Uganda, specifically with Ministry of Health. And we do hope that we are going to continue with this partnership in not only prevention and control of Ebola virus disease, but also health aspects. Now that they are interested in working in this part of the country, we think they should work closely with the Office of the District Health Officer, and together with the COW, they should be able to support areas within their means that is going to make a difference, is going to change what happens in this district. Otherwise, thank you very much for this important meeting. We look forward to very fruitful outcomes if we can implement the resolutions that we agreed upon. Thank you.